Now, financial incentives to keep doctors' appointments to 10 minutes in England are to be scrapped. It's just one part of a new deal between GPs leaders and the government, which will see 1 million of the most vulnerable patients in England given a designated doctor to coordinate all of their NHS and social care treatment. And everyone over 75 will be registered with a named GP rather than a practice. The Health Secretary, Jeremy Hunt, said the aim was to restore the ethic of family doctoring, as Jane Death reports.
In an unsettling time for the NHS, the promise of an old-fashioned doctor's service is like a tonic. Images of Dr. Finley's casebook, where the family GP came out in the middle of the night in all weathers. Then it wasn't about ticking boxes, and now your GP will be freed up to really take patients under their wing.
Because we're sweeping away 40% of GP targets, we're making possible this personalised care for our most vulnerable citizens. And I think it's something GPs welcome, because that's why they became GPs. They wanted to give this care. But more importantly, I think it's something the public will welcome, because it goes back to the values of family doctors.
But is this really the return of the family doctor? Well, not quite. 1 million of the most vulnerable patients will each be assigned a named GP to coordinate all their health and social care. They'll have to check up on them after discharge from hospital and offer same-day phone consultations. And everyone over 75 will be registered with a named GP instead of with the practice. That GP will know all their medical history, although patients won't always get to see that doctor.
Your named GP has ensured that you're on the right medication, that you're having the right care provided, that you're actually referred to the right specialist if that's the case. So there is a coordination of care on your behalf. But that doesn't mean that that GP has to be available all week.
Older patients at his surgery already try to see the same GP.
They do get to know you, and I think they can tell if you've got problems, the way you're answering questions, all of that.
And there'll no longer be a financial incentive to keep appointments to 10 minutes. It's all designed to ease pressure on hospitals.
A&E is creaking at the seams, partly because people have had problems with the GP service out of hours and with the 111 phone system. The government needs this dedicated doctor's idea to work to cut down on those unnecessary trips to hospital.
The government partly blames a Labour-era GP contract which let most doctors off working out of hours.
It's become harder to get a GP appointment under David Cameron, and nothing in today's announcement will correct that. People will still face the frustration of ringing the surgery at 9 o'clock in the morning and being told there's nothing available, and sadly that will lead to some people turning up at A&E.
GPs say to fix that they need a bigger budget. Their personal share has risen to an average of £103,000. The government wanted to publish their pay. GPs are all for a more personal service, but not revealing their personal earnings.